Good evening. Cases almost doubled and new emergency measures. Tonight, we'll be taking you through what the worsening pandemic means for you and your family. As the number of people with COVID-19 in Scotland rises to 60, it's decided at a COBRA meeting of UK leaders we're moving from attempting to contain the virus to delaying the worst of its impact.
From Monday, gatherings of more than 500 people are likely to be cancelled. There will be no overseas trips for school pupils. The message to anyone who thinks they may have COVID-19 is stay at home. There is no need to phone your GP. There will be no mass testing. UPT reports.
An hour after news of the biggest rise in positive cases so far, the First Minister announced the next stage in dealing with coronavirus.
The decision has been taken that we have now moved from a contain phase into the delay phase, where the objective is to seek to slow down the spread of the virus, to reduce the numbers who will be infected at the peak, the numbers infected at any one time. From tomorrow, if you have symptoms that are indicative of having coronavirus, you should stay at home, you should self-isolate for a period of 7 days.
Unlike the rest of the UK, events here with more than 500 people will be cancelled from the start of next week.
The scientific advice I have says that will not have a significant impact on reducing the spread of the virus, but we know that certain types of events can have an impact on our emergency services, our police, our ambulance services, our accident and emergency services, and at a time when pressure on these is going to be acute in the coming weeks, I think it's important that we take away unnecessary burdens.
The new measures will not affect this weekend's Old Firm match, which will see around 50,000 fans at Ibrox.
This weekend, the level of virus in Scotland, although we're moving to the delay phase, the level will be still that the risks to individuals going to that football match are still relatively low.
Ministers are working to double intensive care capacity in hospitals. Schools will remain open for now, although the issue will be kept under ongoing review.
If and when we get to a stage where we are requiring school closures, it will not be for 1 or 2 weeks. It will be for a number of weeks that will take us through until the summer. So that is a significant impact on those who would be affected.
The UK government says the actual number of people infected in the UK could be between 5 and 10,000.
Some people compare it to seasonal flu. Alas, that is not right. Owing to the lack of immunity, this disease is more dangerous and it's going to spread further. And I must level with you, level with the British public. More families, many more families are going to lose loved ones before their time.
The Irish Prime Minister has also escalated measures, with schools, colleges and childcare facilities closed until the 29th of March. In the US, Donald Trump has banned all travel from 26 European countries for a month, although the UK is not included. And in Italy, all shops are now closed except pharmacies and supermarkets. Ewan Petrie, STV News.
To our political editor Colin Mackay now. And Colin, slightly different messages from the First Minister and the Prime Minister emerging.
Yes, after these COBRA meetings in the past, they have spoken as one, and they mostly still do, to be fair. The key message today is if that you have any symptoms of coronavirus at all, a fever or a dry cough, then stay at home for a week. Where this difference is emerging is on gatherings, mass gatherings of more than 500 people. Boris Johnson says he's not ready to cancel them yet. Nicola Sturgeon is, though. From Monday, she wants them all cancelled in Scotland. That means the football fixtures will go ahead this weekend as planned, but that's it. Is this essentially the end of the football season this weekend then?
Look, we'll have discussions with different organisations who are affected by this, but I think we really have to understand as a country that for the next number of weeks, perhaps the next 2 to 3 months, life is not going to be exactly normal. We're going to have to change our behaviour in a number of ways. That's going to be difficult. It will involve difficult decisions for government, but it is all in the interest, not of taking away this virus, because you can't do that, but trying to manage it so that we slow down the spread of it, so that we reduce the numbers infected at any one time to alleviate pressure on our NHS, and crucially, to protect those like the elderly, people with other health conditions who are more at risk of getting seriously ill. And that is why these kind of things that I know are not great for people, but they are necessary to help us get through what is a difficult situation.
But I'm just trying to understand the implications of this decision. Does it mean that there will be no more football matches, for example? They're the biggest gatherings we're talking about.
This policy is going to be in place for a significant number of weeks, given the nature of the spread of a virus and the peak of a curve of a virus. So we will
she's saying
continue
aye.
to be open and transparent about these decisions. We will give further guidance to organisations affected by this policy or any other policy. But I want to stress to people that I don't want to be in a position of facing this. We don't want to have to be taking these decisions, but these are decisions to protect the public, to protect the more vulnerable, and to protect the resilience of our frontline public health system that is going to be under so much pressure in the weeks to come.
The First Minister is promising that detailed guidance over the weekend. Another big question is on the future of schools. How long will they stay open? Well, that's not at all clear at the moment. But what the First Minister is pointing out, that if they close them anytime soon, that could be them closed until the summer. So they're going to keep them open for as long as they possibly can. But the Prime Minister has made it clear today, this is serious. People will die because of this. The First Minister said they will minimise that and do all they can to do so. But it's no longer business as usual.
Colin in Hollywood, thank you. So that's the political response to the worsening outbreak. But what does it mean for all of us? What can we do? And what preparations are being made in communities across Scotland? Louise Scott has been finding out more.
Centres like these are in place to help tackle social isolation for elderly people. As they are one of the most at-risk groups for coronavirus, the worry is that coming together in this way could be more harmful than helpful. At the senior centre, Castlemilk, there is concern.
Sometimes when we're talking together and we'll sort of say, if we took all bits of one another, could we make one whole person? So yes, I think everybody here would say that there is a concern somewhere about an underlying health problem.
And for those in charge, it's a tricky situation.
We're extremely concerned that the information we're receiving changes day to day. What we're here to do is encourage people to socialise, get together, learn new skills. So to do that, they need to come into the centre, we need to meet up, so we need to make sure whilst they're doing that, they're actually also protected.
The number of people that will have to stay at home is likely to increase. Latest guidance explains this means only leaving the home to get medical care and not having visitors, staying in a ventilated room separate from other people in the home, washing hands frequently and using a separate bathroom where possible. GP practices are often the first port of call for patients, but around the country they are having to implement precautions.
It's Dr Mackenzie here from Barclay Health Centre. What can I do for you today?
Doctors here are using predominantly phone and video consultations to treat their patients.
This is now pandemic, so obviously puts significant different pressures on healthcare. The important thing is that other medical issues don't go away just because this is here as well. So we do have to provide basic provision for medical problems as well. Anyone that needs to potentially see a doctor or speak to a doctor goes through us rather than receptionists giving appointments. It's likely that this is going to be the situation for the coming weeks and months.
Tape like this is in place to ensure there is a meter's distance between the patient and member of staff to limit that person-to-person contact. But as restrictions increase, these measures might not just apply to medical practices, but also places like supermarkets, where there's queues. As the outbreak intensifies, the pressures on the NHS are increasing.
Well, Louise joins us in the studio now. Louise, we're hearing about the introduction of these phrases being at just the right time. What does that mean?
Well, when there is a virus outbreak and no precautionary measures are put in place, this is the sort of trend we're likely to see. So that steep increase, hitting the peak relatively quickly before then dying out again. But the issue here is around halfway up. This is where our NHS capacity line is. So anything above that is really in dangerous territory. Now, what we think we've seen in Italy is this steep increase hitting this peak. Not even the peak, sorry. When we hit this point, that's when the authorities decided to shut everything down, which would then obviously curb the cases. Concern is that then when they open them again, we're going to get this second outbreak, second peak spreading again. So what are we trying to do in the UK? as you say, they're talking about the various phases being introduced at just the right point when science tells us, you'll have heard, and that's to create this trend, which you may have already seen. It's the same number of cases but spread over that longer period, but hopefully manageable within our NHS capacity.
Louise, thank you.